However, labor is divided into 1, 2, 3 phases. Latent, active, and transition. Four stages, labor and delivery, 3 phases coming off of labor. Latent is 0 to 3 centimeters, active 4 to 7 centimeters, transition 8 to 10. As long as her water's not broken, this is done at home. It's more desirable to do that at home, because once you come all up in our house, you ours, and we be doing stupid shit. So we don't want you here. You're going to get an infection, we're going to tie you down to a bed, you're going to go through hell. So just stay a little behind home, because at home you can eat, drink, and be merry. But sometimes they're with us for another reason. Maybe they're only, like my poor daughter, maybe they're only a fingertip dilated, less than 1, and the freaking water broke. We always say that the baby put his toenail through the balloon. And they broke your water. Now you're stuck with us. That's a miserable time. Okay, because the water's just going to keep leaking. It just keeps leaking and leaking and leaking and all this other shit. So if this is your patient, you've got to remember a couple things. If they're still early, they are happy, talkative, and generally in good spirits. A good nurse can tell which one you're in over the phone. So when you call me, I already know where you at by your voice over the phone. Because my patient in latent phase, hi, Shellbell, how's your daughter? You know what, I saw the Ohio State game, that was the shit. Oh, by the way, I think I'm going into labor. Okay, baby, well, that's wonderful. How you feel? I feel great, except these contractions, it kind of hurt. Oops, I'm getting now. Let me tell you about it. Oh, that wasn't that bad. Who does that? Early labor. Real early. You still talking. You still making sense. I'm asking you questions, you answering appropriately. That's not going to be the way it is later. Okay, so they're kind of happy. During this stage, patient needs to empty bladder every 2 hours. Patient can drink, stay hydrated. If they're at home, they're allowed to eat. But if they're with us, we're letting them drink at least. Walk around. So that's called ambulation. We call it ambulate and hydrate. If it's all night long driving them freaking nuts, sedate. Only if it's all night long. We ain't try to sedate your ass in the daytime. So she's happy, you're happy, everybody's happy. For now, anyway. This is a good time to get a good history. Find out what's her story. Prenatal history, pregnancy history, what's going on with Sister Girl. Okay? This can last, depending on which kind of baby it is, first baby or third or whatever, can last 8 hours, obviously, if you've had children before, up to 24. Just depends. Labor in general can last 8 to 24 hours. most of the time, for the first baby, most of the time is spent right here. Half a damn day trying to get to 3 centimeters. Only to find out you're only 3. Okay, so you're kind of pissed off about that. Okay, so let's do the active laboring mom, because her conversation on the phone sounds completely different. Hello, Shelly. Yeah, it's Sarah. Yeah, hold on. I'm sorry. I'm so sorry. Look, I'm on my way. I put the bag in the car. We get ready to go to the hospital. Baby, which baby's? I don't know. Oh, okay, baby. Well, I'll meet you there. She ain't making no sense. Shit. Okay, so in her case, she is in pain, and she manages to squeak out on the phone, I want an epidural. So this is a good time for pain meds or epidurals. Very good time. Perfect time. If they want that, can't force it on them. Okay. In this case, you may have a little bit of work to do. So you are encouraging the mommy to keep her bladder emptied. She's not eating at this point. But she is drinking, and popsicles are fine. She's eating, she's having popsicles, maybe a little hard candy to keep her mouth moist. You're giving her cool cloths for her forehead. This is hard work. Her husband or mom might be massaging her. If it's back labor, she's on hands and knees or leaning forward. Make sure you write that. So if it's back labor, she's on hands and knees or leaning forward. This is where her back hurts with every contraction, really, really severe. You're encouraging her to try to walk a little bit. You're changing positions. You're keeping her bed clean. You're changing the linen. Head of the bed is up. Again, she's emptying her bladder every 2 hours. She's definitely 100% effaced at this point. She's 100% effaced. Contractions are every 2 to 5 minutes. Contractions are every 2 to 5 minutes. You're offering her mouth care if she needed it. Talking to her about breathing. If her hands and feet and her face get tingly, she's breathing too fast. Now her CO2 level is high. I'm going to say that again. If she's got tingling in her fingers and her toes and her face and all this nonsense, her CO2 level is high. She's going into respiratory alkalosis. You need to have her breathe in a bag. Okay. All right. Now the last phase is transition, and ain't shit funny here. This is where it's pretty much incoherent. So I would say it like this. She ain't calling me. Her man called me. She can't even talk. Her man is called, or her mom and them is called, And you can hear her in the background. Sounds really weird. All kind of crazy shit. This patient is completely focused inward. They don't talk at all. So where did you go from? You went from the first phase, talking, all the way through the contraction. The second part, which was active labor, you did not talk during a contraction. Now your little ass ain't talking at all. You don't even make sense when you try to talk. So you might as well just hush. We okay with that. Now, this is irritability. You're going to get cussed out. Everybody in the room at least gets cussed out once, including the nurse. The nurse is most likely to get cussed out when she's giving report, because that's irritating. For people to be talking in front of you, especially, just shut the fuck up. That's how they are. That's just how they are. So everybody getting cussed out. The father he's got his feelings hurt unless you, the nurse, prepared him for this and told him in a few minutes, it ain't gonna be funny no more. She's gonna cuss you out. And everything you do is gonna be wrong. And so everything you do, the stuff that worked a minute ago ain't gonna work no more. Leave her feet alone. Don't touch her, because you might get a broken arm in the process. The mother of the patient, who's usually there, is also cussed out. In fact, she ain't never heard her daughter talk like this, and this conversation carries on till the family reunion 10 years later. So you remember when you called me a bitch? You remember that? So, I mean, it's crazy. She don't even realize she did it. She usually strips naked. She's totally naked. Had no idea that she's naked, but she's naked. She has totally focused on herself. Her body is taking control of her, so she has no control at all, and it bothers her. We used to have wooden beds at the hospital I delivered at, and the patient would be chewing in the wood, just chewing the handrails. I'm like, oh my God. So we had to get rid of the wooden beds, get the little fiberglass beds, stop chewing. The wood and the teeth didn't go together. The bite marks in the wood, it wasn't cute. So this patient is in a lot of pain, and they usually say something crazy like this, which the nurse knows means something totally different. If they say this, uh-oh, baby's coming. We're not in transition no more. We're about to have a baby. Okay, we transitioned on out of that. So transition is a time of lack of control, irritability, patient's not really talking. What can you do? Well, ice chips and sips, we call it. Ice chips and sips of water, tiny sips. Ice chips and sips. Again, cool cloths on the forehead. Sideline position or squatting feels better than just laying there suffering. You can do mouth care for sure, because they're doing some breathing at this point. Mouth care is a big one. Change the linen. Do not ask her a damn thing. Quit talking to her. Tell her to do whatever you need her to do. Don't ask her nothing, because you ain't gonna like the answer. So if you're worried about the fetal heart rate and you need her to turn to her left because we know the left side is going to give the baby more blood flow, you better off saying, I'm going to turn you now, shove her. Honey, new nurses, honey, do you mind turning her? Get off me! And the new nurse gets scared to death. Be like, okay, let me go on and take over. Okay, so just turn her if you wanted to turn. Make sure you tell her you need her to empty her bladder. I need you to go to the bathroom. For real? Yes. Okay. She's delirious. Take a few sips of water. Do I? Yes. Okay. So just be directive. loving but directive, because don't ask them shit. You ain't gonna like the answer. Okay, so you get it. I mean, this is like The Exorcist, huh? Okay? All right. Now, then we are done with that stage once we hit 10 centimeters. Agree? And then she's talking about, I feel like I got to poop and all this other kind of garbage. Then you know second stage of labor is approaching. Now, when she was in transition, remember, your job was to get the room ready. You set up the delivery table once she hit 7 centimeters. We said 8 to 10, 8 centimeters, 7, whatever. You set up the delivery table. You're probably not going to get an epidural at 8 to 10 centimeters. That's a little risque because you're sitting up on a baby's head. Remember that you made sure that the neonatal side of the room is ready. You checked the oxygen and the oxygen and suction again, because you did that when they were admitted. Okay, so you did all this stuff. Now, obviously, your patient is admitted in labor, obviously. So in any one of these phases, latent, active, transition, you may have to admit the patient. And again, here we go. Your priority is 5 vital signs. Did the water break? Is she having any leaking of fluid? Is the baby moving? You are obviously checking the heart rate anyway, but usually we put the baby on the monitor for 30 minutes at least. Okay, so the 5 vital signs was baby's heartbeat. We are doing Leopold's maneuver. Leopold's maneuver. And a quick admission history that you really can't do much until you know it is, which baby is this for you? Your due date is the most important question you can ask anybody. What's your due date? Which baby is it for you? And have you had any previous surgeries? Because some people walk in with no prenatal care. And you ain't got no records. So usually they have had an ultrasound, they know their due date. So what's your due date? What baby is this for you? And have you had any previous surgeries? 3 most important questions, right? For your little history. But you did 5 vital signs first, right? You ain't fucking around. You did all 5 vital signs before you did Don't be like the nurse at Murder Mount. They did the paperwork first. They got around a half hour later, per their note, to doing vital signs, at which point the fetal heart rate was 70s. The maternal blood pressure was off the rip, and she's abrupting as we speak, right? So that baby died because you put paperwork ahead of time, ahead of the baby. Don't do that, okay? All right, now, so that's the first stage. The second stage is easy, but instead of just putting big word delivery, put pushing as well. Make sure you know the second stage is pushing. This is 2 to 3 hours for that first baby. We allow up to 3 if you have an epidural. Now, for this patient, mouth care, encouragement, cool cloths on the forehead, changing positions, monitor the perineum. You don't want to have no doctor in the room. Waiting too long to call the nurse midwife, all that old crazy stuff. So monitor the perineum. Your patient needs a lot of encouragement. One of the most encouraging things you can do is tell them you see the hair. There's curls falling out. Something to give them an idea that a baby still is coming, because they don't believe it after a while. They may ask to go home in transition. In transition, which was in the first stage, people literally ask, no, they don't even ask. Okay, I'm going home. They start packing it. They're really intent on leaving the hospital, going home. And now the baby's like at 9 centimeters. So this may be another point where I just want to go home. Home represents safety. And they're very sick of this shit, okay? So that's delivery. Now, the beginning of this may be when they say, I got to poop. Don't forget that. Okay, 3 is placenta. Generally takes 5 to 10 minutes, but we allow up to 20. The placental delivery generally takes 5 to 10 minutes, but we allow up to 20 to 30 minutes. Technically, you have 30 before shit gets real. It takes 5 to 10 on average. You should worry at 20 to 30 minutes that something's not right here. Okay? Now, during the placental delivery or third stage of labor, don't forget this, give mommy the baby and let her play with the baby, shit. If I was doing an emergency delivery where I'm not in a hospital at all, like Shump did for the Cavaliers, his daughter, then he would or I would, we will put the baby to breast. Because breastfeeding at this point will encourage the placenta to come out. You had to know the signs that the placenta is ready to come out. Write these down. You have a gush of blood. You have a placenta, the uterus, or fundus as the name is, rising and getting firm. And then you have cord lengthening. You gotta know those. Those are the 3 signs that we're going to have a placenta come out. The placenta has separated. It's time to deliver. These 3 things are going on. I'm watching for this myself. I'm watching for these. But so is the nurse. Because if things don't come out, this is going to be a nurse and a doctor issue in a minute. Now, there's 2 sides. There's a shiny Schultz. And there's a dirty Duncan. Lou, you making sure you get these. Shiny Schultz and dirty Duncan. The shiny Schultz is where the fetal side came out first. It looks like this membrane completely around the placenta, which looks like a piece of liver. Just shiny. This is the baby side, fetal side. The dirty Duncan is globular, bloody, funky looking, like it could be missing a part here and there. You have to check for intactness. But that's maternal side. That's the part that was attached to her uterus.